Friendly Harbor Community Center serves any and all individuals with mental health and substance use conditions and their families at our home location and via outreach into the community. Almost all clients live in Pueblo County, with occasional services provided to residents of Fremont and El Paso County, and all services are free. Outside our home location, we provide services to those involved with the Behavioral Health Treatment Court, the Veterans Treatment Court, Dependency and Neglect Court, Safe Babies Court, and the Rescue Mission. During the COVID pandemic, we provided a warm line to anyone who called. We know these services have a positive impact based on client and agency feedback. On client feedback forms, clients consistently report that peer services were very or extremely helpful, noting particular appreciation for the non-judgmental nature of the individual contact and help accessing resources. All Friendly Harbors programs are provided by peer specialists. Peer specialists are individuals in recovery from mental health or substance use disorders who have received special state-certified training in how to use their experience to help others enter or maintain recovery. Research has shown that such peer support decreases rates of suicide, substance use, and hopelessness, and increases treatment engagement, employment, return to school, and quality of life. Friendly Harbor provides services in our warm, welcoming home and in the community. In our house, we provide mental wellness, mindfulness, 12-step programs, smart recovery, interpersonal and emotion management skills training groups, individual support and coaching, system navigation, and a safe haven for stigmatized individuals in socialization and recreational opportunities. We connect suicidal individuals with treatment. Many clients have described the Friendly Harbor as their home away from home, a good place to be when not in a good emotional place, and a lifesaver. During the COVID-19 pandemic, one woman with a traumatic brain injury called our warm line 4 to 5 times per week, reporting that this peer support kept her sane and not hospitalized during this difficult time. Friendly Harbor provides similar services on an individual basis in the community.
Yeah, so some years ago, one of my work partners, Roxanne Pignanelli, She, right after a school shooting, we know the power of the arts. We know the power of presenting things with documentary films. I made a documentary film on post-traumatic stress in our veterans, and I also had done a play called Seven, which was about women and the different things that women go through, and it was it's a beautiful, beautiful play. So we knew that if we use the medium of a play, that it can also have an impact on really on getting the word out about mental health, on getting the word out for suicide prevention. And at first, Roxy found this play called Bang Bang You're Dead, which was about a school shooting. And we presented that play, and then we heard from the Colorado, the person, head of Children's Hospital in the state of Colorado, had said that um, the suicide rates amongst the youth in Colorado was really on the rise. And we thought that that was an area that we should really tackle. And so what we did is we found this play called No One Hears Unless You Scream. And it was kind of, in some of the writing needed to be tweaked a little bit and just brought up to modern day times. And so what we did a workshop with our students at the Arts Academy of Pueblo County High School. And we sat down with kids, with mental health professionals in the room, and just talked about some of the issues and said, how would you tell this story? What issues are pertinent to you right now? And every time we've used that same mechanism to retell the story and to also bring in other issues or issues that are more pertinent, because things will change in a semester. Believe me, it's like, one semester it might be this thing is the latest thing, and then the next semester it's another issue. So that's kind of how it really began, and we just noticed that it had really great success, not only for the students who participate in it, but also for the students um, who came to watch it. And because we do a talk back afterwards, we have uh, mental health professionals on and resources, a resource table, and anyone after watching the play can immediately go and talk to a mental health professional. We make certain that they know of 911. We also have started a thing where we tell the cast, and we also are going to be training the cast in QPR, and also in ending and giving them. NAMI has a program called Ending the Silence, because one of the things that we found out is that a lot of the young people that ended up in a situation where their friend was considering death by suicide, that they didn't know how to handle it. They didn't know what to do. And so we really realized that that was an important thing to say, well, this is what you do. This is how you handle it. And give them those answers as well. And really, it's about doing things with the community, not to a community or for a community. It has to be youth-led and youth-driven, youth peer-to-peer. That's where the power is.
Would you like me to start with how it all started?
Sure.
So, I was teaching art classes at PSAS after school when I was about 23 years old. So that was like 20 years ago or more. And I had a group of drawing middle school boys that were drawing. And as most people understand, that middle school boys are quite challenging. And so one day I went into class. I hated going to that class. I hated it. They didn't like it either. And so one day I'm like, I don't like you. You don't like me. And so we wrote some poetry that day. And I would say that by the end of that class, they were crying and so was I. But we never had another problem after that day, because it gave them an opportunity to express themselves. And it was a very profound moment for me. For the rest of the class, we understood each other. So I sat down and I wrote a whole bunch of activities. I went to my grandmother's house, that winter, and I pitched a class to teach called Kids in Expression, and basically takes the arts and turns it into a vehicle for self-discovery, for exploration.
This is what one man has to say.
Fine. Art has saved my life so many times, and I think it's been my connection to myself and my connection to others and my ability to destroy myself and create myself all over again.
This man has worked at a place called the Friendly Harbor to help them help others.
Well, I have a music. It really elevates the mood.
All right, so today, there's the healing arts. I think that I kind of take the art of psychology and smash it with the visual arts. So, and then I needed a pencil box, to be truthful, but I found my first aid kit at temporary. So art is temporary. I had no control over it. I built it on land that I didn't own. Right? So, and I'm so glad you returned. And I'm glad you brought daughter. Right? Or is it, and what we see is beautiful. Others may not see. And that's okay. And they may not get us. They may not get it. And that's okay too. Because it's more about our journey and our own journey. Of people that will maybe never see the beauty that we are. And so I'm curious to see how you draw that, how we draw those things. How do you see, what is your beauty? And regardless if anybody sees it. So don't judge it.
The connection between art, healing, and public health. This is a review of the current literature. Over the past 2 decades, there's been a major increase in research into the effects of the arts on health and well-being, alongside developments in practice and policy activities in different countries across the World Health Organization's European region and further afield. Results from over 3,000 studies identified a major role for the arts in the prevention of ill health, promotion of health, and management and treatment of illness across the lifespan. For the scientifically minded, the reviewed evidence included study design such as uncontrolled pilot studies, case studies, small-scale cross-sectional surveys, nationally representative longitudinal cohort studies, community-wide ethnographies, and randomized controlled trials from diverse disciplines. A 2016 study looked at dancing participation, and cardiovascular disease mortality. They found that moderate intensity dancing was associated with a reduced risk for cardiovascular disease mortality to a greater extent than walking. Music is the most accessible and most researched medium of art and healing. And there has been a principal evidence on the soothing capacity of music and its ability to offset overly technological approaches to care. In particular, music therapy has been shown to decrease anxiety. The pleasure shared by participants in the healing process through a music therapy program can help to restore emotional balance as well. There is also evidence of the effectiveness of auditory stimulation, together with the strong suggestion that such stimulation abolishes pain, giving a strategy for controlling pain. In addition, it has been shown that music can calm neural activity in the brain, which may lead to reductions in anxiety, may help to restore effective functioning in the immune system, partly by the actions of the amygdala and the hypothalamus. A widely researched phenomenon is the use of music in the control of chronic cancer pain. 5 benefits of using music therapy with cancer patients have been reported in the literature. Increases in hospital patients' sense of control, promotion of wellness and the healthy aspects of the patient's lives, reductions in pain and increases in immunity, decreases in anxiety, and reductions in psychological and physical symptoms. In several clinical studies examining the effects of music and music therapy on healing and wellness, music has been found to be a form of relaxation and anxiety reduction. In one study, after listening to relaxing music for 20 minutes, participants exhibited significant reductions in heart rate, respiratory rate, myocardial oxygen demand, and in particular anxiety, both immediately after and 1 hour after the intervention. A 2013 surgical study demonstrated that patients exhibit lower anxiety levels before and during surgery when hearing music, and they have a significant reduction in analgesia and sedation requirements. A 2013 surgical study demonstrated that patients exhibit lower anxiety levels before and during surgery when hearing music. They show a significant reduction in analgesic and sedation requirements. Music was found to reduce the heart rate, blood pressure, and muscle effort of surgeons, while at the same time increasing the accuracy of their surgical tasks. Surgeons who played a musical instrument were found to perform surgical tasks better. The most appropriate music in the operating room seems to be the classical type. Visual art has been shown to help people express experiences that are too difficult to put into words, such as a diagnosis of cancer. Some people with cancer explore the meanings of past, present, and future during art therapy, thereby integrating cancer into their life story and giving it meaning. In one cancer study, women engaging in different types of visual art were helped in 4 major ways. First, it helped them focus on positive life experiences, relieving their ongoing preoccupation with cancer. Second, it enhanced their self-worth and identity by providing them with opportunities to demonstrate continuity, challenge, and achievement. Third, it enabled them to maintain a social identity that resisted being defined by cancer. And finally, it allowed them to express their feelings in a symbolic manner, especially during chemotherapy. There is also evidence that use of art and music reduces hospital stays, with studies showing earlier discharges among patients taking part in visual and performing arts interventions than among those not doing so. In one study, surgery and critical care patients who participated in guided imagery or had a picture of a landscape on their wall had a decreased need for narcotic pain medication relative to their counterparts, and they left the hospital earlier. Expressive writing studies have shown that relative to control group participants, individuals who have written about their own traumatic experiences exhibit statistically significant improvements in various measures of physical health, reductions in visits to physicians, and better immune system functioning. Writing increases health and wellness in varied ways, as shown in the expressive writing studies. These are only a few of the many examples of the benefits of art. Additional studies have shown that just observing artwork in an art gallery has a significant impact on the mental and physical health of our isolated elderly population. Post-COVID, and with the increased concerns about our children's mental health, these studies offer solutions. Is it worth the money?
Oh, absolutely.
Why?
It's number one, it's really enjoyable, and it helps relieve symptoms, stress, depression, anxiety. Having that activity, can not only help you express your feelings or it can be a nice welcome distraction from some symptoms. And so it's just a really good way to creatively express yourself and have an enjoyable activity, and it's a good hobby.
It's a form of release. You can express yourself in ways that you can't verbally express yourself.
Can you give me an example?
I've done a picture of meds, like on my tongue, because I don't like taking a lot of meds.
I was going to say, that doesn't sound very attractive.
Right, no, it doesn't sound very attractive, but it was very releasing, and therapeutic in the fact that me becoming a little more okay with my meds.
Interesting.
And when I look at it, it reminds me that, that's where I need to be. And I've seen other participants express similar things. It's just a very important way to express yourself in a non-confronting way. that's very therapeutic.
Making time for the creativity, and it also directly benefited my work, and I saw that. Our original goal was to give was to focus on staff wellness, especially during and post-COVID. We noticed that there was a lot of difficulty keeping up with self-care. I liked the freedom. I liked having something that wasn't very rigid. I work in an admin position, and it's all very rigid. And being able to be creative in that setting did help me get out of whatever funk I was in. So I think it's therapeutic, but I don't think that it was therapy. I think it helped me get more into a creative mindset, especially when it comes to problem solving. Getting into a creative mindset does help me see multiple paths for the problem solving that I have to do. Sometimes my work, I have to make a lot of changes along the way, and having that creativity built into my job does help me be more adaptive.